Hello, my name is Terry Peterson, and I am the Director of Strategic Key Accounts and Special Projects for Essilor Instruments USA. I'd like to introduce you today to the epi-c Plus therapeutic technology made by the company Espansione in Bologna, Italy. The advantage that we have in the epi-c Plus is it's a combination of two therapies. The first one is called IPL, or intense pulsed light delivery. The second technology of the epi-c Plus is called low-level light therapy, or LLLT. And low-level light therapy is a photobiomodulation. What we'd like to do in this particular video is to show you how this technology is applied to a patient. So the first thing is on your epi-c Plus, to turn it on, there's a toggle in the back. We'll turn one switch on, and this will start a fan. The screen will go through a cut version of Windows. It's Windows CE. And once it goes through Windows and loads the Espansione software, it's going to ask you for a password. And that password is 12345. But if you happen to forget it, the card that comes with the unit, on the side where it says Quick Start, it'll basically tell you to enter the password 12345. Here's where we would enter our password. I take my stylus from the side and I go 1, 2, 3, 4, 5, and I hit enter, and this brings us up to the main menu. Now, assuming that you want to work in English, you'd hit the American flag. I'll hit the American flag. The first thing that we're going to do is that the instrument asks us, do we want to do an IPL or do we want to do a photobiomodulation, or what they call light modulation? When the unit is shipped and or when you're not using the IPL cartridge, there is a dummy cartridge here. And this dummy cartridge has no lamp inside, but it allows us basically to park the control handle or the treatment handle without having the crystal in place. So I'm going to take this, I'm going to turn it over. You take your thumb on the back side, and it's kind of like a poppy top bottle. Just push out and up, and the cartridge will come right out in your hand. The instrument will be shipped with an IPL crystal or an IPL cartridge. The noise or the wind turbine that you hear is a chilled air that will go through the back of the crystal and actually cool that crystal down. On the front of the crystal is a UV filter. If I take the IPL crystal, I place it into the handpiece and push it in, the noise stops. Once we start using it and that crystal gets hot, then the wind turbine will come on to cool it down. We'd hit IPL and we hit enter. There are going to be two choices here. One is 600 nanometers, one is 390 to 1200. I'm going to hit 600 and I'm going to hit enter. And it's a little redundant, but you'll see up here where it says IPL, I'm going to hit IPL and I'm going to hit enter. It sees a 600 nanometer cartridge. So we're going to hit enter. Now Jessica, our patient here, we did a OSD I-score on her, and Jessica indicates that she tears a little bit in windy days, has a disruption in using PDAs in her computer after a long period of time. She actually feels that her eyes may be drying out. She noted to me that she had a little bit more difficulty driving at night. We did a me-check analysis on her. And the me-check indicated that she was a Pulse Scale 3. Since the Pulse Scale goes from 0 to 4, she's more on the moderate or advanced moderate side of dry eye disease. So what we're going to do, where it right now says select skin features, when we say select skin features, the input that you're supposed to put in is the Pulse Scale. Her number from the me-check was a 3. And so I'm going to input 3, and I'm going to put enter. The next one asked me is where it says automatic phototype selection. This is what we call the Fitzpatrick Scale. The Fitzpatrick Scale goes from 1 to 6. We have to know how much melanin or pigment is in her skin. I'm going to ask her some questions. So when you're out in the sun, do you easily get burned under the sun? Yes. You can get suntan, but your skin is sensitive to the sun exposure? Or are you sometimes gets burned under the sun, gradually gets suntanned to reach a medium brown color?
The first option.
She's the first. What this tells us is that in the Fitzpatrick Scale, she's a 2. This is very important that this data is inputted into the instrument. So Jessica told us she's a 2. Now before I do that, the one thing that you can do, in the bottom of the IPL cartridge is a photosensor. And if we take this photosensor, and I'm going to take Jessica and I'm going to have her turn her wrist over, if she would please. And right here, where the skin is on the back side of her wrist, is something that's not really exposed to sun very often. The other place that you could do it would be underneath the chin. But since I have the accessibility to her wrist here, I'll put the sensor there. I'll push the button, and it actually tells us in relation to the photosensor that her melanin is more towards a 1. You can either use the 1 or the 2. 2 would be her subjective response. We'll go with the 2 at this point, and we'll hit enter. By placing the Pulse scale, the Mybography level 3, and the Fitzpatrick Scale, the level 2, the instrument gives us the treatment protocols. It tells us that we're going to treat at 28 joules here. We're going to do 10 exposures to Jessica. And before we do this, we're going to put a pair of blockout goggles on her to prevent her from seeing the flash. And the first flash will be right next to the nose. This will be 1. We move over, overlap in 2. Move over, overlap in 3. Move up on the canthus, do number 4, and then we basically take a blend shot across number 5. And we'll do this in both eyes. A pair of goggles is placed over the eye. They look like tanning goggles. So we want to express to her that this bright light is about as bright as anything that she's ever seen, and that it might startle her. If you tell the patient up front that light's coming, then the reaction is minimized. The second thing is that from a treatment standpoint, the treator, the person applying the treatment, whether it's a doctor or technician, should be wearing goggles to prevent that light from basically affecting their retina. And anybody else in the room that is exposed to that should not look directly into that. We're going to have Jessica place on the goggles over her eyes, and we just need to make sure that they're nice and tight and cover her. I'm going to place on my goggles, and I'm going to move to the other side of the treatment bed here to actually apply the treatment. And what we do is we're going to reach the handpiece. I'm going to come in and I'm going to hit enter. The instrument should beep at me. It beeped there. This now tells me that I'm live. What I'm going to do is I'm going to count 3, 2, 1, and at 1 I'm going to push the button, so just don't look into the light. So you ready, Jessica?
Yes.
Okay, so I put my first treatment where it's next to the nose, and I'm going to go 3, 2, 1. Very bright light, right?
Very bright.
Okay, but she hardly jumped, felt just a little bit of warmth. I'm going to take the second one. I'm just overlapping and moving toward the ear. 3, 2, 1. The third one, I move over even further, get it nice and tight to the cheek. 3, 2, 1. The fourth one, if she's got any bangs or anything, pull that away. You're going to place this right over the canthus, so the middle of the crystal or the cartridge, there's a little block on the side. If you take halfway on that block and place that right at the middle of the canthus on the goggle, and I go 3, 2, 1. This would be shot number 4. Shot number 5, I just turn the handpiece to where it's horizontal instead of vertical. I'm placing the notch up against the nose. 3, 2, 1. There's number 5. Shot number 1, 3, 2, 1. Shot number 2, straight up and down, blending over, 3, 2, 1. Shot number 3, a little bit further out, just blending, 3, 2, 1. Got to make sure they overlap. The 4th shot is at the canthus, 3, 2, 1. And then the 5th shot, we're going to basically push that a little bit into her nose, blend everything there, nice and tight up against the eye and the skin, 3, 2, 1. And those are the 10 shots. Redock the handpiece, and the first thing that you want to do is you want to reach over and hit escape. Once you hit escape, the cartridge is no longer armed. What I'm going to do then at this point is I'm going to kind of reach over and I'm going to escape out, and I'm going to escape again, and I'm back to my main menu where the IPL is still highlighted. But in this case, what I'm going to do is I'm going to highlight light modulation, or the low-level light therapy. I'm basically going to say enter, and I have 3 choices here. Red, which is used entirely for inflammation. Blue, which is used for bacteriological overload. And yellow, which is used for drainage. The most predominant color is going to be red, so we're going to hit red, and we're going to hit enter. Light modulation, and hit enter. And what you're going to have is you're going to have a red half mask here. I'm going to reach over in my handpiece, and what I'm going to do, and then at this point, is eject the IPL cartridge. The wind turbine comes back on again. If I go ahead and take the mask and place that in, this gives me an electrical connection that powers the mask. I'm going to redock my unit. I'm going to tell it okay, because it sees red, and it finds red on the bottom because it sees that there's a red half mask. I'm going to take this and place this over Jessica's head. I don't think the band needs to be this tight, so let me open this up. And what we're going to do here, let me get that around your bun here. Okay, thank you. And I'm going to place this on the face. I want you to feel that brightness, and then when we turn this on, you're going to actually feel the warmth as if you were exposed to the sun. I'm going to hit enter. It's going to give me 15 minutes of treatment in this case, and I'm going to hit enter again. This starts the procedure when I hit the button. At 1 minute, the mask is going to start to flash. And so when the mask is flashing at this point, what we're doing is we're pressing in a little more power. So it compresses in, lets it off, compresses in, lets it off, does this for about 1 minute, and this is flashing. Ideally, it's just letting us know that we're near the end of the procedure and we're just getting that little bit more push or power in there. We've now timed out at 0, and so what we're going to do is we're going to take the mask off. Now, what I'd like to ask you at this point is how your eyes feel.
Moist. My eyes feel very moist.
Okay. Common descriptions of our patient is my eyes feel moist, my eyes feel cool, my eyes feel calm. I want you, when you're working with your patients, to look at the cornea and look at the reflex of the tear. The tear is dramatically improved. You see the tear sheen, you'll see all this extra fluid. We want to make sure that we tell the patient at this point that this therapy is not just what you feel today, that this cellular regeneration, this restructuring of what's going on in your cells takes weeks and months, that you should have ongoing effect with this. Based on her mybography, based on her speed scores here, or her OSDI scores here, we would expect that Jessica would probably be one of our patients that about 85% of patients like this are what we call one and done. We'd do this one therapy and they'd get anywhere between 1 and 2 years worth of relief. We thank you for being our patient, and hopefully you enjoy the therapy.